I'm the student nurse today. So today what we're gonna be doing is assessing your head to toe, and this is just to assess all your bodily functions and everything. I'm gonna quickly ask for your first and last name and date of birth.
Caitlin Register,
Okay.
01/19/1991.
Okay, may I see your wrist? Thank you. All right, I'm gonna go ahead and provide us with some privacy, and then we're gonna begin. First, I'm gonna assess your skin. I'm just gonna inspect it as I'm doing now. Now I'm gonna palpate it. All right, and I'm gonna check for any dehydration, anything. I'm just gonna pinch your skin a little bit. All right. Skin is congruent to race and ethnicity. Pigmentation is even all throughout. Skin is also dry and warm, with good skin turgor. No tinting was noted. Now I'm gonna go ahead and assess your head. I'm gonna inspect it as I'm doing now, and then I'm gonna palpate. And as I palpate, you just let me know if you have any pain or tenderness.
No pain or tenderness.
All right, thank you for that. So head is normal cephalic and midline. There was no pain or tenderness upon palpation. No masses were noted as well. Next, I'm gonna go ahead and palpate your frontallary and maxillary sinuses, okay? All right, maxillary, and that was your frontallary. Okay, so upon palpating, did you have any pain or tenderness?
No.
Okay, so no pain or tenderness on bilateral frontal and bilateral maxillary sinuses. Yes. Now I'm gonna ask you to do a series of facial movements, and you just follow as I go.
Okay.
So could you puff up your cheeks for me? All right, could you smile for me? Could you clench your jaw? Okay, could you wrinkle your forehead? And could you squeeze your eyes shut? Thank you so much. So facial features are symmetric at rest. They are also smooth and symmetric upon facial movements. Cranial nerve 5 and 7 are intact. Now I'm gonna give you something to eat. You're just gonna let me know how that tastes to you, okay? And I'm gonna ask if you could close your eyes as you do this. I'm gonna put your hand out, yes ma'am. All right, you can go ahead.
It's sweet.
Okay, you can open your eyes now. Patient correctly identifies sweet taste. Cranial nerve 7 is intact. Now we're gonna go ahead and move on to your neck, okay? So I'm just gonna palpate it, and I'm gonna inspect it as well as I'm doing now. Let me know if you have any pain or tenderness as I palpate, okay? Did you have any pain or tenderness?
Mm-mm.
Okay, so trachea is midline. There was no pain or tenderness upon palpation. No masses were noted as well. I'm gonna go ahead and assess your lymph nodes. You let me know if you have any pain or tenderness as well. Preauricular, postauricular, occipital, tonsillar, submandible, submental, superficial cervical, posterior cervical, deep cervical, and subclavicular. All right, did you have any pain or tenderness?
No.
All right, no lymph nodes were palpable, no tenderness or pain was noted. Yes, now we're gonna move on to your eyes. First, I'm gonna inspect your eyes. All right, no sclerius icterus or protrusions of the eyes noted. I'm gonna go ahead and ask if you could just follow this pen line, just moving your eyes and nothing else, okay? Okay, perfect, thank you very much. Eyes move smoothly through the 6 fields of gaze, knowing the nystagmus noted bilaterally. I'm gonna need this again. I'm now going to ask if you can look at a distant object. I'm gonna bring this close to your eyes, and you just adjust your eyes as I move it. All right, perfect, thank you. I'm just gonna go ahead and inspect your pupil size. All right, just gonna shine a light in your eyes here. Okay, trying to lighten your eyes here. I'm so sorry. Okay.
Okay.
All right. So, oh, excuse me. I forgot to say, cranial nerve 3, 4, and 6 are intact. When we did the diagnostic test. So now your pupils were at a 4 mm before light was introduced. They then constrict to a 2 mm after light is introduced. Pupils are accommodating from a far object to a near object. Pupils are equal, round, and reactive to light. Cranial nerve 3 is intact. All right, now I'm gonna switch off the lights and I'm gonna assess your red reflex of your eyes. Oh, wrong light. All right. And you could just look straight ahead for me. All right. All right, perfect. So, red reflex was present in both bilateral eyes. Alrighty. Now we're gonna move on to your ears. I'm first gonna inspect it as I'm doing now. And I'm also gonna palpate. And you let me know if you have any pain or tenderness, okay?
No pain or tenderness.
Alright, thank you very much. So, bilateral auricles reveal no erythema or crusting. There was no pain or tenderness upon palpation as well. Now we're gonna take a look into your ears, okay? Alright. Okay. Make sure I was on the right side. I'm gonna pull your ears back and up. Sorry. I'm gonna do the same with the other side. Up and back. All right, perfect. Thank you very much. So bilateral auricles are patent. Bilateral external ear canals are free from any foreign bodies, discharge, edema, excessive cerumen. The tympanic membrane, both bilateral tympanic membranes were intact, translucent, and pearly gray. The cone of light sat at a 5 o'clock at the right ear and at a 7 o'clock in the left ear. Now I'm going to assess your hearing. I'm just going to stand about 2 feet behind you, and you're going to occlude the opposite ear that I'm standing at. And I'm just going to repeat 3 words to you, whisper 3 words, and you're just going to repeat them back to me, okay?
Okay.
Pink star 5.
Pink star 5.
Okay, and I'm going to do the same with the other side. You're just going to occlude 1 ear. Thank you. 6 dime blue.
6 dime blue.
All right, thank you very much. Patient correctly stated 6 whisper words. Cranial nerve 8 is intact. Now I'm gonna assess your hearing again. This is a tuning fork. I'm just gonna smack it on my hand and put it in your head, middle of your head. You're just gonna let me know how you hear it in both your ears, okay?
Equally in both ears.
All right, thank you very much. Patient hears equally in both. Patient hears sounds equally in both ears. No lateralization was noted. Now we're gonna go ahead and move on to your nose and mouth. Okay. So first, I'm just gonna assess your nose. You're just gonna look up for me. All right. Thank you very much. Now I'm gonna ask if you can occlude 1 nose. I'm gonna ask also if you can close your eyes. I'm gonna put a scent into your nose, and you let me know what that smells like. Okay, it's there.
Alcohol.
All right, same with the other nose. Eyes closed still. It's there.
Alcohol.
All right, I'm sorry if that was strong. All right, so nose is midline. Nose is also patent. Patient also correctly identifies scent in both bilateral nares. Cranial nerve 1 is intact. I'm now going to move on to your mouth. I'm just going to ask if you can open your mouth for me. All right, thank you very much. Could you lift your tongue for me as well? Thank you very much. So hard palate, soft palate, buccal mucosa, posterior pharynx and tongue are all pink and all moist. Teeth are of good hygiene with no dental caries and they're white as well. Tonsils were present and at a 2+. Uvula was midline and frenulum was intact. Now I'm gonna go ahead and ask you to do a few things for me. You're just gonna swallow for me. All right. I'm gonna ask if you could open your mouth real quick for me. All right. Stick your tongue down. All right. Could you say ah?
Ah.
All right. Thank you very much. Now, could you repeat light, tight, and dynamite for me?
Light, tight, dynamite.
All right, perfect. So, patient, patient swallows on command without any difficulties. When patient says ah, both uvula and soft palate do rise. Cranial nerve 9 and 10 are intact. Patient also clearly speaks, also has clear speech when she speaks light, tight, dynamite. Cranial nerve 12 is intact. Now we're gonna go ahead and, yes, now we're gonna go, well, I'm gonna check real quick. Okay, yes. Now we're gonna go ahead and move on to your respiratory and cardiovascular system. First, I'm just gonna inspect your chest. As I'm doing that, I'm gonna also inspect your breathing. All right, next I'm gonna check your AP to transverse ratio. I'm gonna ask you to lift your arms up just a little bit. All right, thank you. Chest is symmetrical with no deviations. Breathing sounds were regular, even, and unlabored. AP to transverse ratio was at a 1:2. Now I'm just gonna ask if we can turn this way for me. All right, I'm gonna place my hand right here, and you're just gonna breathe in and out. Thank you very much. Posterior chest expansion was posterior chest expansion both equally rise bilaterally. Now I'm going to put this stethoscope on 6 fields of your lungs, and you're just gonna breathe in and breathe out as every time you feel my stethoscope, okay?
Okay.
Okay. All right. All right, thank you. I'm gonna have you turn back around. I'm gonna do the same thing that I did to the back to the front. You just breathe in and breathe out. Okay, could you lift your breast up just a little bit for me? Same with the other side. All right, thank Thank you very much. Breath sounds were clear in all 6 lung fields, anterior and posteriorly. Anterior and posteriorly. No adventitious sounds were noted as well. Now I'm going to go ahead and move on to listening to your heart sounds, okay? All right, first I'm going to start at your aortic, which is right sides of the sternal border, second intercostal space. All right, now I'm going to move on to pulmonic, which is left sides of the sternal border, second intercostal space. All right, now I'm going to move on to your tricuspid. This is also right sternal borders, fifth intercostal space. All right, I'm going to ask if you can lift your breast for me. Thank you very much. I'm listening to the mitral, which is left sternal border, fifth intercostal space, by midclavicular line. All right, thank you very much. S1 and S2 were noted. Yes, S1 and S2 were noted. No extra heart sounds were noted, and no murmurs were noted. Now I'm just gonna go ahead and assess your capillary refill. I ask if you can bring two fingers out for me. Okay. All right, thank you. And I'm gonna ask if you remove your shoes for me. Thank you. And your socks as well.
I was not prepared.
I'm sorry. This is my fault. I'm sorry.
These are some bad shoes.
It's okay. It's okay. Mine were barely done, okay? All right, I'm just going to do the same here. All right, perfect. So capillary refill is less than 2 seconds in upper and lower extremities bilaterally. I'm going to give you some time to put your stuff back on.
It's okay. You go ahead.
Okay. We're going to now move on to your pulses, which are your brachial, radial, and so forth, so on.
Okay.
All right. So first, I'm going to assess your brachial. All right. I'm going to move to your radial. Okay, now I'm going to move on to your posterior tibialis. And your dorsalis pedis. Alrighty, so what was I gonna say? Brachial pulse, radial pulse, posterior tibialis and dorsalis pedis pulses were a 2+ regular and even bilaterally in upper and lower extremities. Yes, now we're gonna go ahead and move on to your abdomen. So I'm gonna just lay you flat down here. Hold this out for you. All right. First, I'm going to inspect it. All right. Abdomen is flat and umbilicus is midline. I don't want to lift your shirt because you're my teacher. That would be weird. Yes. I'm now gonna auscultate. All right. All right. Normal active bowel sounds are noted in all 4 quadrants. I'm now going to percuss. tympani is noted in all 4 quadrants. I'm now going to palpate, and you let me know if you have any pain or tenderness in when I'm doing superficial or deep palpation, okay?
Okay.
I'm gonna first start with superficial. Okay, now I'm gonna move on to deep. All right, did you have any pain or tenderness? All right, you're good to sit up. All right, abdomen was soft. There was no pain or tenderness upon palpation as well. Now we're gonna go ahead and move on to musculoskeletal. I'm gonna ask if you could stand up for me. Thank you very much. You can stand right here for me. So first, I'm gonna ask if you could put your neck to your chest. Now, could you lift your head up and back? All right. Could you look left and right? Thank you. Could you extend your hands out like this and just flex it up? Perfect. Now, could you bend your knees for me? One knee. And then extend it out like this. Perfect. Could you do the same with the other foot? Thank you. Now I'm going to ask if you could just lean forward a smidge. Thank you. And lean back. Thank you. Now you're going to lean to your left and lean to your right. All right, perfect. Full range of motion in all neck, arms, legs, and spine. No crepitus noted or limitations. Oh, well, did you have any pain or tenderness while moving? No. Okay, good. You can have a seat right here. All right. Now I'm just going to ask if you can grip my hands for me as tight as you can. Perfect. Now I'm going to ask if you can keep your hands out like this. I'm going to push down and you resist. All right, same on the other side. All right, I'm going to do the same with your legs. Foot. All right, perfect. Muscle strength is a 5 out of 5 bilaterally in upper and lower extremities. I'm now going to do the same with your shoulders. Just resist as I push down. All right, perfect. Shoulder strength is a 5 out of 5 bilaterally as well. We're going to move on to neuro now. For this, I'm going to ask you to stand again. Okay. All right. So for this, you're just going to stand straight, all right, for 5 seconds. All right, now I'm going to ask you to close your eyes and stand as well. All right, thank you. Now we're going to do your tandem walking, and this is just heel to toe walking. 3 forward, and then 3 going back. Perfect, thank you so much. Romberg was a negative test, was negative. No swaying was noted. No swaying was noted. Oh, tandem walking test was smooth, steady gait with no balance loss bilaterally. And yeah, you can have a seat. Okay. Just gonna refer to my notes quickly.